and share the screen with you. It's hard to believe it's May 10th. It's been a year and 2 months since we started this journey on COVID together. And let me just start the slideshow from the beginning. So today's policy session is going to be on day services and home and community-based services. And like I said, for those of you that just came on, Nicole will be joining me later than expected because of a last-minute White House meeting that she told me. I told them I'm going to get off by 12:30 at the latest, so look forward to seeing her then. And before she comes on, I will be playing you a video of HCBS and answering. We can have a discussion around that as well before she comes on. But COVID update. Virus numbers increased less than the week before, so that's great news in terms of the big picture. The total now is 650,859 people who have had the virus. The week before, it's lower by 3,472, which is significant. And then the number of people who died rose by 68, which is terrible, to bring our number over 17,311. But this is 24 below last week. And I don't know if you recall, the death numbers were not, one week they went down, one week they went up. So hopefully this will be a trend that will continue. The USA shows a drop of 13.2%. Deaths are approaching still 600,000, not quite there yet. And then the highest state per capita rates, Rhode Island, again, beat South Dakota out for the second week in a row. Utah beat Tennessee out. So there's North Dakota, Rhode Island, South Dakota, Utah, and Tennessee. And then in late March, just to give you a sense, we reported a 13,000 virus increase. So it's just, not that long ago, and 248 deaths, just to have some perspective on this, that it is getting better. Unfortunately, in our congregate system, the good news on deaths are getting either very low or not at all, and hopefully not at all from this point onward. But that's, in terms of looking at that, it's still increased by 2. And I don't know how much that's because we're looking at a smaller number, and the people that work in the homes, they're in multiple homes, right? And if it's still hanging in there with us, because we're talking about a census of about 8,500 people that are served. 8,500, something like that are served through the homes in the state operated system and the provider operated system. And the state operated numbers are flat at 10 cases, while provider homes have 34 cases with no deaths in both settings in the last week. And due to smaller census size, I'm saying those numbers from late March do not vary, but we do see an 80% decrease compared to numbers in February. So I had to go back further to see, and obviously February was the end of the spike, that period, right? Where we had a terrible spike and surge in the state. And then in terms of recovery numbers that I've been sharing with you, there's still a 20, state op homes are just a little ahead of, in terms of having the virus, or number of people who experienced the virus and recovered, whereas provider homes are a smaller number that caught the virus, but still they're both above 20%. And I shared with you the facility ones, both nationally and in our state. The numbers at the facilities are much bigger because, again, more people together, more people spreading the virus. So Nicole is going to join us, and basically I'll introduce her when she comes. I'll go back to that slide. But I really want to focus today on both home and community-based services in general and day services in particular. And I think many of you know this, the pandemic combined with our workforce shortage is providing an unbelievable challenge in terms of reopening, so that some organizations, even though the number of feet between people has gone down in terms of guidance, it's still very hard to hire the staff to fill those openings between the time they're told there can be more people and actually filling the staff. To be really clear about that, one agency told me they had 42 people still waiting. and people that they can fit. And the other problem is transportation, okay? That's going to continue to be a problem until things change. So those are sort of the pieces. What I'd like to talk about with you and have a bit of a dialogue is really about what's happening now in the short term. Let me get out of the screen. Let me get out of the share so we can have a bit of a dialogue to talk about this. And I want us to be able to, hold on a second. I think I'm not sharing anymore, right? Let me just get back to you guys. I'm having trouble seeing everybody. Let me get to gallery view. So there's two things going on in day programs, and feel free to ask questions about this. The first thing going on is that Department of Development Services partnering with the Trade Association of Developmental Disability Providers, and the ARC. They're doing an outreach to find out people's experiences during the COVID pandemic and sort of what they see for themselves looking ahead. And most of this surveying, first with staff, there have been 2 forums in March that took place, in employment and day services that the Trade Association and DDS worked on together. And then coming more recently, there's been family surveys, and there's a survey live right now for people. And then there's a new survey, focus groups for persons with disabilities to participate in focus groups. So these are all happening as we speak. And there's no, what would you say, firm direction or guidance, because information's still being collected. And the good news is the input's going on. In fact, I see Chris White's on today, so I might even ask him to weigh in on that in a second. I'm going to ask you in a second, Chris, to join in and share. But Chris is the CEO of Road to Responsibility, a great colleague of mine, but he's also the chair of the Trade Association right now. So I'm pleased, that he's here today. So the other piece we want to tell you about today is this changes, and people asked about this, which is sort of what spurred making sure we covered this piece, that the day habilitation program, we're not sure exactly where that's going either, except it's going to be stable. It's going to continue to be a site-based program, but there's going to be changes in how providers are reimbursed. And it's something in the background. It's something you, as a participant or a family member, don't see. But they're going to go from reimbursing providers from every 15 minutes to reimbursing them for half a day or a full day, what they call per diem or per half diem. So I just translate it into human language, that's all. And then the second piece of that, which I think has people more nervous, and I get it, change, especially post-COVID, is something to get nervous about. That this right now, the Department of Development Services does supplemental funds. They call them SUPs. And so because the mass day hab rates were what they were, there's 3 levels of rates that the funding happens, that there were people with either complex medical conditions or behavioral conditions who had significant daily living needs that could not be covered just with the rate alone. And I think the best rate, and Chris will correct me on this if I'm wrong, is 1 to 3.5. I don't know how you do 1 to 3.5. So for every 3.5 people, there's 1 person FTE. That's how they bill what they pay the provider. So they're going to, the DDS would give extra dollars based on what help people need that's one-on-one. So if you might aspirate and if you eat too quickly, maybe you'll have for your meal, right? A one-to-one staff allocated. If you need help, all day, you might have a staff person assigned all day. So it really depended on what the person's individual needs were. And of course, providers were used to DDS and its method of determining that, right? So now they're also going to be going through a period where they're going to want, how will this change? And basically, there's really no way to do it except individualized, because the only other way to do it would to establish new rates in addition to the 3 rates that exist. So I'm going to ask Chris to weigh in for a second and correct me or clarify if I said anything too funky or too elementary, but also to add to it. Go ahead, Chris.
Leo, I think you did a good job laying out where things are at right now. And obviously the workforce is the biggest issue by far. We have wait lists here at RTR at every single one of our day programs. And while transportation is an issue for some of them, the vast majority of the issues is because we can't staff up. It's just taken us forever to recruit new staff and have them actually show up, make it all the way through orientation, and then get put into the programs. A lot of people are ghosting us these days, and from talking to my colleagues at other agencies, it sounds like we are not alone by any stretch.
So, and Chris, just to be clear to people, you actually have additional space now, right? Because it went
Oh
from,
yeah,
okay,
I
for
am.
about a few weeks, right? That where the new guidance came through.
Yeah, we could add significantly to the people who are coming into our center-based programs now. But again, we based on square footage, but we just haven't been able to do nearly as much as we could because of the staffing shortage.
Leo, this is Charlie. Could I make a comment and ask a question?
Sure, Charlie.
I
Hey, so
think-
let me just say, so it's a close colleague for years, decades probably also, Charlie Carr.
Yeah.
In fact, I've known both for decades. It's wild. And Charlie's former commissioner of the Massachusetts Rehabilitation Commission. Please do, Charlie.
So one of the things that we're feeling outside of facility-based and group home care in the personal care assistance world is the effect of the extended unemployment. And a lot of folks are making more by not working than they were when they were working. So I think that contributes quite a bit to the worker shortage. My question is there an effort on the part of groups, advocacy groups, ARC and others, to capture some of that ARPA HCBS money to boost up salaries to attract workers?
Yeah, yes. And you know what? I'm going to let Chris talk from the trade association perspective first, and I'm going to talk from stuff we've been pushing for since 2018 now, that, we may have to go alone in our space. But again, PCAs face the same issue, right? Barriers and others for in-home. So Chris, why don't you react
Sure.
first to that?
Hi, Charlie. It's good to see you. It's been a while.
Same here, Chris.
But yeah, as you know, the state issued an RFI to help guide them in spending the ARPA monies. And what we're pushing for, since it's one-time money, is a program of hiring bonuses and retention bonuses. That would be significant, but you're absolutely right. The extension of the extra unemployment has been a devastating piece for recruiting efforts. People just got a pretty good size check in the mail from the IRS, and then being able to collect, again, as you said, more than they were making working full time. It's keeping too many people out of the workforce.
So that was the push from Nicole, who'll be on later, for over a year, as Charlie, watching the national stuff, where we were trying to get some dollars and funding around that. Now the ARC across, it's an interesting thing. I've had people come on from other states, and we're going to continue to do that about this national crisis. So we tried to do something cross human services together. It hit a bit of a wall. So now the trade association has started meeting has a workforce subcommittee. We've been pushing, and I think most of our report still stands from 2017, late 2017, about the crisis. We're probably going to go for our space. Maybe we'll make it cross disability to include PCA and things like that. Maybe we should be talking to the IL centers and whatever, make it disability instead of just IDD. And we're open to that. Given some of the barriers we're facing with other sectors in our space, that we're really taking a hard look at just focusing on our constituents. In New Jersey, they've pushed for, let's get to 25% above minimum wage strategy. We like that. We had pushed, you may remember, for a year and a half ago to start a $17 entry wage as part of a rate, not a separate funding mechanism. It's part of the rate setting process. And so we're still feel strongly about, dollars. We're willing to go to, let's go a percentage above minimum wage if that's what ADP and other groups want to do, and we talk with the friends, maybe we'll go broader. I know the house is burning, sort of how we feel about it. And Colorado, New Jersey, they've been successful with some strategies, either using the pay piece, like we've said, or using the 25% strategy. They had, by the way, some compression in New Jersey, which they addressed last year, but that's something we've all talked about. Chris has been one of the people that actually, wears a few hats, so he's been part of the thinking on our end as well about it. So, yeah, we're trying to, with the chapters, our close sponsor friends, our families, trying to have a resurgence. So for this rate process right now, for day in employment, we're saying 13% is the least the rate increase should be. And the rates will be opened up again in January for our day in employment, and I assume family stabilization. I guess they haven't explicitly said they'll open them up again for family stabilization, which is the family support centers and autism support centers and the like. But the initial rate was 2%, Charlie. The initial rate that they announced, which is—
So Leo, what's the average starting salary for somebody, not in state ops, because I imagine it's a little higher, but in community-based homes?
The base salary I hear about is, and it varies, so let's be clear, but 15 and change, between 15 and 16. But there's some people who do overnights that are getting minimum wage, right? Some places where they pay a more rich fringe benefit package. Actually, with the 10% last year, it probably is in the 16 range now. Chris, do you hear about this?
I know the median wage for people working residentially is about 16.75, something like that.
Is that blended? Is that blended? Is that blended?
It's blended as far as years of service in a position. Yeah. And so not the hiring wage, but what's interesting is that's the median, and supposedly the state's trying to get their average that they build into rates to be at the median range, yet they built in a lower rate than what we're already paying people. And the state ops get paid about 35% more than our folks do.
So the other thing, the people that are furloughed, I'm curious, they still get health benefits, but if people were laid off, they would not get your health benefits unless they get COBRA, correct, Chris? So yeah. One of the questions Susan's asking is, on top of the additional unemployment, are they getting health insurance coverage, the people that aren't, basically coming back to work? And I would think they have to go through the connector, right, to get their health insurance.
Not necessarily. Part of the ARPA is a provision that makes COBRA free for people.
There you go. And then do you get reimbursed, or are you paying that COBRA, Chris?
We pay that, and then we get reimbursement in the form of tax deferments.
And that's for everybody, correct?
Correct.
Payroll tax deferments, by the way, is what he's talking about in his case, because obviously, because they're a nonprofit, regular tax deferment wouldn't help them too much. But that means, are you getting the entire thing deferred, or just the individual portion?
The entire thing. Yeah.
Because you'd really be sunk, right?
Oh, we'd be.
Okay.
So we wouldn't be able to do it.
I have to ask that follow-up from Susan's question, because otherwise, I'd be wondering, is that part of the struggle providers have had during this period? In addition to, obviously, individuals with disabilities and families are having their struggles at home, trying to get staff in. And, we've talked about, and Charlie, you haven't been on these, we've talked about the extended service system, or service net, safety net. And that's what I call, what we advocate for, whether it's family support or shared living or PCA or AFC, where people are, self-direction services, right? Where people are sort of in their own trying to build a good life, you know, more individualized, and how much they've sort of lost out. And even as someone with a physical disability, yeah, they didn't lose out. They got additional hours, but if they can't find people, right, they're not really gaining, you know. But and then we have people with impairments, cognitive or behavioral impairments, that couldn't even get right hours. But if they got the hours, they'd be just more competition for the people that were already struggling to get hours, you know. So, and it's no one's, you know, you can't really blame. I think it's a national problem, the devaluing, right, of our workforce and the people with disabilities that we have to overcome. And it's a chance, you know, with the one thing about the Biden plan that, you know, I can't help but, you know, respect him greatly, is that he's put on the table a $400 billion package, separate from what Charlie and Chris just talked about, that would revolutionize. And that's part of the conversation with Nicole is, you know, what kind of impact from her perspective does she see? And then separate from that, there's a bill being discussed in Washington, D.C. that we're going to touch on as well. Anything you want to add to this? And I want to show that video before Nicole comes on. You guys, either of you?
Leo, I think the strategy around the use of the ARPA money being one-time money is a good one to get bonuses and pay increases. But it kind of sets a precedent too that might be sustainable long-term if we mount the proper type of a campaign. And I do think there is some value in the different groups coming together as one voice. So I would just close by saying that something to look into more.
Yeah, well, clearly, given the other sectors aren't, like there's one large organization that's focusing on a bill that's just a comparison to state employees, and that's something we don't think in the long run is probably, you know, given the markets, we're not up against just state employees, we're up against like people who work in hotels and people that work at education and people, you know, we want people that will go on and work in education to stay with us, right? We want people that go on and work in healthcare to stay with us, right? We're not out to be myopic here in terms of what our goal is for ourselves or our constituents, you know? So let me show this tape. Hang on, people. I'm not gonna mute myself because hopefully this is gonna come over, and if somebody can go to the chat as I play this to say you're hearing it, that would be great.
37 states still have institutions where people with disabilities live segregated lives.
Deinstitutionalization is moving people
live segregated.
Hold on, I gotta share my screen. That would help, right, for you to see it as well. So we're gonna do that, and then here we go.
Lives.
Deinstitutionalization is moving people with intellectual and developmental disabilities from the institutions that they were historically housed in to basically into their community, basically into their own homes, their own houses, and they basically can be an integral part of the community and not be segregated and put off somewhere.
They institutionalized my sister in Dixon State School. We missed out on having any kind of childhood together. And I know that she lived in a very, very harsh environment.
Institutions don't work, their rights are taken away.
When I got out, which was a happy day, I was about 19. I like to see freedom bells ring. Every institution that closed, let the bell ring.
It's a good thing to close large institutions, and I truly believe that anyone can live in the community if they have the right supports.
I helped close one. I was able to work along with my advocacy team to help close that one. The people that was living in the institution come out and they're doing good. They're doing good.
Institutions limit people's lives and choices. They must be closed. More than that, communities need the resources for people to live independently. Join the ARC in fighting for life in the community. thearc.org/joinourfight.
Oh, hold on, obviously.
There's a great big
Okay, we're not going to Disney World, sorry. That's what happens with YouTube, right? So the key piece of that was part 2 for me. And actually, Mary Ellen Mayo is on, who lives in Michigan now, one of my past president, a great friend. And she was there. We were in the courthouse when and one of the people on the other side of closure was screaming at her because a radio reporter was interviewing her. Remember that, Mary Ellen? Yeah. So, but really, it's really the part two, like community resources for everybody is really what we're missing, right? It's not, to me, like, and I like that tape because it's also got Giassi on it. They repurposed, Giassi was on, I don't know if he still is, they repurposed your video, Giassi, very effective.
I know, thanks.
Yeah, that was pretty cool, right?
Yeah.
You didn't know you have a lifetime of taping now for the rest of your life. You're going to be on, but it's really, it's so important to appreciate that just closing the institution doesn't solve it, right? And it's really about getting the resources, the funding, and also giving people choice in the community, right? And I just, recently, because of the workforce shortage, some people I'm pretty close to, which actually a couple of families have reached out about some of the stuff they're facing and what are good provider organizations, and just the inability for some things to get done, and or visitation, right, being tough as it was that you all went through during the process. So, there's a lot here to think about. So what could be different? Let me, and then Nicole will be on any minute, but let me talk to you about what could be different. If right now, still today, it's far easier to get an institution bed, whether it's especially a nursing home bed, right? It's far easier. It's like an automatic ticket. But a community option is not an automatic ticket, And the day and employment stuff that's going on right now, sometimes it's about, we've had some lawsuits historically at the ARC that we've succeeded in, right? But if we can't have people working, right? And people that really not just do the job, but also have the values that are trained around person first. And, we all, let's say any one of us could need personal assistance tomorrow. And some of us on this call do need personal assistance today. We don't, we want the people working with us to respect us fully. And, I will share the YouTube link, Kerry. And folks, Daphne, we're going to put it on in a second. When Nicole comes on, I'll take a couple of minutes to put those on.
Well, Leo, one thing when Nicole comes on is there is legislation, federal, that is designed to reduce the institutional bias, because what we have is nursing homes are an entitlement, right?
Right.
You get a nursing home. Community living is not, and
Right.
this bill, among other things, levels that playing field by making community living an entitlement.
Are you talking about the existing bill, Charlie, or are you talking about the one the draft that Senator Casey and Sherrod and Representative Dingell?
Yeah, the
draft?
Casey bill, yeah.
Oh, you're talking about the separate Casey, because there is a discussion draft for a full.
I have not seen the discussion draft.
Yeah, that's with three legislators. Senator Casey, is it? I think it's Senator Brown, Sherrod Brown, is it Rep Brown? And then Representative Dingell. She had a press release on it, and I'll get you guys that as well, the link for that. And we're waiting to hear what they come out with. And I think there's a previous bill that you're talking about with Senator Casey from Pennsylvania. So, which is really important. Let me put up, I'm gonna also share the link, Independence Can't Wait, and that will take you to some other links. Okay. But so this is not a really, this is something that we're like at the precipice of, that we've never been before. And it's sort of scary. We don't want to lose the opportunity, I want to say, because even though Charlie mentioned there was a bill before, oh, here she is, Nicole, great. Let's get in, that's great. But we don't want to lose this opportunity, because we were struggling right under President Trump to see Casey's bill go anywhere. So it's a huge factor. And then Nicole's just joining us right now. Hi, Nicole.
Hi. Hi, everyone.
So we just played the tape, the institution closure tape, FYI, that you guys have, and then said how part 2 is really the most important part, which is getting the community resources we need. And Charlie Carr, former commissioner of Mass Rehab Commission's with me, as well as Chris White, who is the chair of the trade organization, our state. And we were talking about the workforce crisis and some of what could happen with the $400 billion and the Dingle bill. And did Senator Casey have a bill that was just sitting right before the new discussion draft happened that we were unable to get traction on because of the Senate?
No. There was that, and hi, Charlie. There was a bill from March of 2020, the HCBS Infrastructure Incentive Act that Senator Casey introduced. That's not likely to be the vehicle, just because it's not big enough to carry $400 billion, frankly, and it was broader. But we do know, I mean, we're working very closely with Senator Casey and Representative Dingle's office, as well as with the relevant committees, so Energy and Commerce in the House and Senate Finance in the Senate, as they're sort of grappling with the way to operationalize President Biden's proposal from the American Jobs Plan Act, or what we assume will be called the American Jobs Plan Act. And so that is the $400 billion that obviously I'm sure you've been talking about. As far as, I can't get too specific yet. We haven't seen much, so it's not because I'm trying to be coy. That's not my style. It's more just that we're still figuring out what it's going to look like. What I will say is that it's very likely that it's going to look similar to the mechanism used in the American Rescue Plan, which I know isn't ideal since we're still waiting for the guidance from CMS, which I have been told will for sure come out in the next 2 weeks. But I've been hearing that for a while. But I just heard that from CMS this morning.
That $400 billion. Go ahead, finish your thought.
Just that it's going to come in the form of an FMAP bump, but that it's going to have more belts and suspenders around it, obviously, than what happened in the rescue plan. The rescue plan, as folks recall, there was allowable uses and those got stripped. There's some political wrangling about the why of that, but really nobody really went to bat with the parliamentarian on that. And so they're confident that because of things like the fact that budget reconciliation was used, for example, with the Affordable Care Act, and Community First Choice was part of that, and that was a choice, not a mandate. Anyway, so we're feeling confident that there's going to be a way to do it.
Hello.
And ultimately what it's going to be is that it's going to be some sort of split between workforce and services.
So the big question I have on that, the $400 billion, is it in disability and seniors? Is it broader than that? Is it broader than disability and seniors, the $400 billion?
It's not broader than disability and seniors. What I will say is that we are making sure to cast a wide net when it comes to disabilities, so to make sure that there are supports for behavioral health and that sort of thing, but it's not broader than that.
So if we could give a context for the $400 billion, I was thinking of Massachusetts and what it could do in terms of workforce, because our biggest, just access is still, there are issues with access, right? But the bigger thing is the workforce, availability of people, both for in-home, whether it's personal care attendants or for the programs. We have residential programs, day employment. Right now, there's waiting lists in Massachusetts to re-enter day programs because they can't, and that's got nothing to do with the square footage.
No, it's workforce.
Leo, one thing that occurs to me is our own Elizabeth Warren sits on Senate Finance, right? And there's no reason why. I know Mass Health has issued an RFI. They're looking for our ideas. Everybody and their sister-in-law are out there with ideas, but it wouldn't hurt to communicate with her staff about what the pressing needs of ARC are.
Yep. And we were just up. We were actually some weeks ago, we had meetings, and actually Senator Markey personally joined us, and Senator Warren's aides were with a group of, I'd say, 40 constituents at least, where we had a virtual meeting because it sort of fit in with our disability policy seminar, the ARC and several organization co-hosts. So, but we should follow up with her, Charlie, you're right. and keep on top of it. But I
Yeah.
also, my national office is also working with her too as well.
Yeah, I mean, the fact of the matter is that obviously, like, a Senator Warren is always going to be super influential and important, but because Senate leadership and House leadership have tapped Casey and Dingell, that's where a lot of this is happening. And there's some strategic questions, I'll say, and I'm sure that won't surprise folks that are a little more.
What you're trying to say, let me say it in another way. So because so much is happening and President Biden just got elected and there's all this settling going on, we just, they just took over the Senate, right? So now it's sort of people like Senator Casey, right, and in the House, they have to sort of agree, right? Who's going to carry things for each branch? So they won't be fighting later during conference committee, right? Because they have enough fights to do unfortunately, with the Republicans. Bipartisanship is not, in our blood system this year or last year for the last 10 years. So I think what you're trying to say is because of that, the normal committee process sometimes doesn't work as well. And people who are in those roles have to be careful how they play a role, right? For people not to feel like confusion going on and too many leaders, too many cooks in the kitchen.
Right, which isn't to say I agree with that, but it is to say that's how it's going. And yeah, but luckily you all in Massachusetts do have two very strong advocates that I'm sure any of you would have to do is, push a little bit or, in one direction and it'll go the right way. And Senator Warren was incredibly helpful, for example, when we got HCBS included in Medicare for All. So certainly she certainly understands, as well as Senator Markey, about the need to make this investment. I think fundamentally, the thing that's been really interesting that I've been sharing with anyone that I'm talking to is actually also so first of all, I'm not sure if folks know this, but there is nothing that is polling better from the infrastructure bill, so from the American Jobs Plan, than the HCBS money. That's important because the White House definitely knows that, and so does the Hill. But the other thing that's kind of interesting and that I'll just kind of put out there as a thing to watch is that I know that there's been some kind of like big political attacks from like people like Senator Blackburn and Senator Scott. But the reality is that there's actually not a huge target on this from most Republican offices, which I think will ultimately help us get a good chunk of this, assuming that it's done strategically. And when I mean when I say that is, the ARC has been really lucky and been really careful to be part of kind of the mix of groups that are working on this in the disability, aging, as well as labor space, which as everyone on this call knows is complicated. But we were part of a meeting that included Nicole and Little Lobbyists and the ARC, and then it was AARP and Justice and Aging.
By the way, Nicole, just so
the National Council on Independent
Living Centers, which Charlie was the leader of one of our regional ones before becoming commissioner, and these other groups that are really important, to have at the table. Go ahead, Nicole. Sorry.
Yeah. And so, no, it's just, we're lucky that we're kind of one of the few disability groups that have been at the table with AARP and then with SEIU and the National Domestic Workers Alliance. And I'm raising that because it's going to be complicated what comes out of that, because there's obviously varying interests. And so, for example, the
National Domestic Workers Alliance is a few unions. I can't remember right now. SEIU, I think, is part of it, right?
They're part of it, yeah. And and they work on a broader set of issues around domestic workers too. But we've been working really closely with them with shared recommendations. That I was joking with Kelly and Mike Oxford, both that work with Nicole, that it's more negotiated than the Magna Carta, just about kind of some common ground that we can get to as far as what this money should look like. And actually, Leo, you'll be seeing it because we're sending it around to all the state offices if they want to sign on. Right. And it's tricky because it includes things like allow workers to have the option to organize. And so,
can hit message, so we know that's coming, right? That and again, nothing's wrong with that. Let me be really clear. Unfortunately, with some of the, some workers unions are awesome, and some, make it really tough to get rid of employees you want to get rid of, and I don't mean that in a bad way. I just mean sometimes people, we initially were going to get opposed on the registry by one union, and we had a conversation 7 at night and they backed off, thank goodness, right? Because they realized there was no upside for them. Why do we want to keep someone who's abused someone that gets onto a registry, right? But it's even the fact that we had to have that conversation, right? And they eventually embraced it, and we're seeing it. Supporters send a press release out on it. It was like, that's what you mean by the Magna Carta. I mean, it really gets complicated. Now, you just were talking the White House. Anything juicy you can let people know, right?
I mean, the White House was just making sure that we all know that we have to work together and march in one direction. It's the same kind of meetings that we've been having for the past few months, which is part of why we're sending. I mean, and the great thing is that we already have like over 200 organizations signed on to these shared recommendations, and it is really important that we're showing that, because or else we're always at the risk of getting nothing, right? Like that's the reality that we're in. And
you get 13 months. You guys were hammering away at HCBS, and now that we have it, what you're telling everybody is the administration realizes, wow, there's a lot of juice. People are reacting so positively. There's press, there's letters, right? That was your point, right?
Yep.
They realized, oh no, why didn't we do this before?
It's a good political issue.
The coalition there is behind HCBS, right?
Yep.
Yeah.
It's incredible. I mean, and it's a huge testament, obviously, but just to say it out loud, to the work that everybody has done, not only obviously during COVID, but since all the threats started in 2017, because it's fundamentally because of that. It's not just because it's a good political issue for the party that happens to be in charge right now. It's also because all offices have been hearing about the need for these services for 5 years, and they've been getting hammered on it.
We need bipartisan, clearly, a situation where that discussion draft becomes bipartisan, even if it's one person, right? And the other thing for all of us to not get discouraged. We've been through a really tough year, right? And things did happen. Finally, it happened, and it wasn't just finally; it's because of the hard work. And I can tell you, with our office, we're like aligned so closely across the country. It's awesome. And they have a team of 5 people plus communication person plus a grassroots mobilization person. We tested in the middle of COVID, a brand new action center that's got texting. Okay, that's how ridiculously invested we all are to work together. And because of what's at stake, lives are at stake, and families are at stake.
Leo, I've got to jump off. I have a 1 o'clock, but I'd like to get into Nicole a question. So we were talking before you came on, Nicole, about the worker shortage, the unbelievably bad worker shortage.
Yep.
And can you just, from a national perspective, offer your thoughts on the drivers behind this shortage, and what can we do on the grassroots level to deal with it?
I mean, fundamentally, it's about wages. Like, I wish it was about something else, but that's really what it is. And obviously, you have workforces that shrunk when services were closed, when things were, and the idea that it's going to be real easy to re-up when a lot of businesses are making it real appealing to come work in jobs that are less stressful, more money. It's exacerbating, obviously, a problem that has existed for a really long time, which is why, we really have to make sure that $400 billion sounds like a lot of money, but when we talk about the big problems that we have in the service system, $400 billion could easily get sucked up just looking at the workforce issue, or it could just as easily just get sucked up looking at the waiting list issue. And so fundamentally, it's about how do we use this big shot in the arm to get us closer to addressing the issue, and then how do we build in, not only legislatively but administratively, some tools and levers to make sure that we're doing a better job of allowing for rates to actually cover costs of services, and also allowing for wages to have some parity with minimum wage, or some attachment with minimum wage. That's something that we couldn't have even contemplated until this huge investment is being made, because then we're going to be a lot closer. And obviously then huge federal investment, I would hope, being someone who obviously came working at the state level, will make it easier to do some of that state level work to continue the state level investment. I know that that's not like a great answer. I wish I had more specifics, but I do think that we are also in a really unique moment in time. Just today, there was an article in the New York Times about a mother and a daughter who are both direct care workers, and the $9 difference in their wages because of the states that they live in. The national, again, to Leo's point, the national attention is really leading me to believe that we're in a moment in time where we're not just talking about this $400 billion. We're talking about fundamentally getting to the root cause of these issues. And I'm not a really positive person, but I actually do think it's true.
You're a realist. You're a realist, is what you are. But I guess my follow up, and I'll be quiet. So that 10%, I mean that FMAP bump that we'll see for the HCBS money. So we're talking in Massachusetts about a bonus system because it's one-time money, and maybe upping the reimbursement rates. Do you think that will spur on the state level a willingness on the part of state government to sustain that increase if we're able to get it over the long haul, or will they drop it like a hot potato once the federal money's gone?
I think that everything that I'm hearing from when I'm talking to states is that it's unlikely that the 1 year of funding is going to be used for anything that couldn't be dropped like a hot potato. I think that it's possible that states will do it knowing that the $400 billion conversation is out there, but I do think that it's a lot more likely from everything that I'm hearing that they'll kind of wait and see on the $400 billion and do one-time investments with the 12.7, which is not obviously what I'm advising, but it's just what I'm hearing. So
okay, thanks.
Yeah.
Any other questions for Nicole before we call it a day? It's 12:49. We usually actually stop at 12:45. Anybody else have anything they want to ask? I just dropped in the New York Times article.
Thanks, Leo.
I'm a new, my first time joining this group. It's
welcome.
Very wonderful to see you all. I'm concerned about the bill that would seems to carve out life-sharing communities or communities where people are integrated, disabled, non-disabled people together, which happen to provide a place to work and a place to live, that seem to be carved out of the federal funding and would then rely on a much lower rate of state funding. And I feel that's would be a real loss, and it would not provide the choice that people who have not as high level of functioning would need to have. For instance, someone who can't cross the street by themselves, if they live on a farm, like my son, he can work as a baker and a farmer, and he'd be stuck inside in a group home otherwise, and wouldn't have the choice of the life that he wants to live. And so I think that I know it's difficult to distinguish what's institutional versus non-institutional, but there are, communities that provide a lot of integration and integrate within the larger community. But if you just go by a definition that a person can't live and work in the same place and get federal funding, that misses out on I think, a very efficient and very good choice for people. Thank you.
Sure, thanks. So you're talking about the ICF model, and there's actually nothing, and that is certainly, it is a funding stream under Medicaid long-term services and supports. And I'm glad you brought this up because I've actually seen a lot of confusion around this. So that is not something that's going to be impacted in a negative way by any of this funding. It's not carved out. It's not included, to your point. But the HCBS investment is about investing in the alternative to those services. It doesn't take anything away. It doesn't like move one on equal. It just puts both on the same footing, because right now those ICFs are mandatory under the federal Medicaid program, whereas home and community-based services aren't. And so I agree with you on wanting to make sure that we're ensuring choice, and we can't really ensure choice unless everybody who wants HCBS also has access to those. And so I understand, and we're definitely having conversations with we do have our chapters that run ICF, so we want to make sure that people who are receiving services in those settings and the workers in those settings are also supported. It's just a little bit separate conversation, but it doesn't mean we have to make sure that both are being addressed, certainly.
And separate conversation is the best way to do it. And I would just add, just reinforce what Nicole's saying, just we haven't gotten the supports like the woman whose sister lived in Dixon State Institution. She said, the same amount of support should have been available to her. I would have loved to see her stay in our community and get the help crossing the street or whatever. But that doesn't mean that this bill just makes it a level playing field, which we haven't had historically. So that's really all this does. The community rule is a different thing. But anyway, thank you. Thanks for coming. Hope you visit again. And we do this. I'm not sure how long we'll be doing this every Monday. We're going to reevaluate. But right now we're planning to do it for the next month or so. And then we're going to sort of reevaluate what kind of makes sense for everybody in our community. So great seeing everybody. Mary Ellen, great seeing you too. And Chris, thank you for being part of this. Nicole, thank you so much.
Oh, wait, just one quick question. Should we use the same Zoom link for the Leo Lives? Because this is a new Zoom link.
I think this new link is from now on. I'll have to check. If not, you'll get another one, and then I had a different strategy in mind for this week. I wanted to see what would happen if we didn't make you register, but that didn't happen. So that was a miscommunication probably on my end. So I have no idea. So good question, Giassi. We'll get something out soon. So we clarify that. Thank you for asking.
Yep.
Thanks.
All right. Thanks, everybody. Have a great week. And
Thank you,
again,
too.
we appreciate Chris participating and Nicole for joining us. Have
Bye.
a great week. Take care. Bye-bye.
Bye.